Good day. I am Dan Bogdanov. I am the head of the Department of Information Security Systems at Cybernetica. Today, I will tell you about the Estonian experience in building secure and private infrastructures to enable the future of services. My main thesis for today is that building reusable and secure service infrastructures means that you will always have a foundation to build on. In the future, the work that you have done today will let you do more and with less investment, especially if you follow security principles. I will build my presentation on the example of COVID-19 testing and notification service, as it was deployed in Estonia this year. The first aspect I will be covering is getting the test results from the labs to the electronic health record of an individual. The Estonian e-government and all e-services are built on top of the X-Road platform. On this figure, you see the red nodes as services. The bigger ones are larger services with more connections, and the black lines are connections between the services. This is the topology of Estonian e-government. Many interconnected services. You see that there are no large central nodes, meaning that instead of copying all the data to a central node, there is strong interoperability between all parties. And this is also the case in healthcare. Estonian healthcare services work on the X-Road platform. It is the backbone of all our governmental services. All transactions on X-Road are end-to-end encrypted, authenticated on the secure channel, and also digitally signed to the level that a transaction on the X-Road can be admissible as evidence in a court. For example, information flows from hospitals, clinics, and labs to the electronic health record are run over the X-Road platform to the Estonian Healthcare Information System. The Estonian Healthcare Information System and its interface, the patient portal, form the e-health record for each citizen. If I want, then I can see what the data is, and almost all my doctor's visits go there. This is achieved by making certain that the health insurance payments are given in exchange for the data. So earlier this year, when the COVID-19 crisis hit Estonia, a system was built that has stood the test of time. All COVID-19 test results are reported to the e-health record, including ones for foreigners. For them, there is no personal code, usually. This ensured that we can start building services on top of that infrastructure. Now we get to the second step. If some data exists, then the next important part is how can it be used? And for that case, Estonia has built the patient portal. It is the access point for all citizens. I can log in using my digital identity, for example, the Smart ID phone-based system that is available in Estonia. And then I can represent myself or my children. I can book new meetings with the doctors through the national e-booking system. I will be shown times from various hospitals or clinics across the nation. If a hospital close to me is busy, then I can get an earlier time in another city, maybe. Furthermore, I can get a history of all my health story, my e-health data, my immunizations, and case summaries, and so on. A new innovative service built this year is marked with a red oval on the figure. It is the Coronavirus Analysis Lab results. Even though you can get a notification about your test result on a phone by SMS, for example, then there is a button, a big red button in the patient portal, which you can click, and you will then learn whether you have a positive test. And because this data was collected over the X-road in a secure manner, and it was securely available, and access to this information is only available for me using my digital ID, then this service was built to great security standards in a relatively short time. And secure access to one's own data is a key philosophical aspect in the Estonian government. And it stands on the shoulders of the Estonian Secure Digital ID. It is required for accessing any kind of e-services in Estonia. We are currently using 3 strong eID technologies in parallel. The ID card, which stores the authentication and digital signature keys on the chip. Mobile ID, which stores the same keys on the phone's SIM card, which acts as a hardware security module. Or Smart ID, which uses a modern cryptographic technology called threshold cryptography to distribute the keys between the device and the backend in a way that doesn't allow the backend to impersonate you, and it also helps you easily detect whether the phone with the keys has been cloned. So it is one of our newest solutions, and it has quickly become the most popular thanks to its ease of use and certification status, ensuring its security. Among the 3, the last 2 are available on mobile phones. The first one, it is not. Some time ago, there was a vulnerability detected in the ID card that created a potential for misuse of digital ID. The ID card was fixed. The technology was upgraded to a more secure version, meaning that the insecure keys are no longer in use and have been revoked. At that time, we were thankful for having multiple different digital ID technologies, because in a heterogeneous system, we could continue working. And that is important because these ID platforms are mandatory for all government employees, because also they have to authenticate to every system they use. And this also leaves a trail when they use it. In the Citizen Portal, I will have an overview of who has been looking at my data and whether it has been for a particular purpose. So for example, if I go into a Citizen Portal and I inquire about my own data, I will learn about which agencies have been accessing it. So this level of transparency is a great benefit. This year, when we needed to quickly ramp up COVID-19 testing and ensure that everybody gets the results in time as quickly as possible, then because the data was already there, we could quickly build services that allowed the reuse of that data. Furthermore, in addition to the COVID-19 test result service, multiple new services were built or existing ones amended that supported the rest of the procedures that the government needed to take in this time. For example, making it easier for everybody to report themselves as ill without having to go to the doctor, doing it so remotely, and so on. Multiple services were built quickly in response to the crisis, and it was possible because the infrastructure is there not only for healthcare data, but for other social and welfare data. Now I get to the third part, supporting the operation of the contact tracing app. The contact tracing apps have been great development this year, and there are multiple different techniques. A lot of this comes back to Trace Together, one of the early pioneers in this field from Singapore. Estonian app is called Hoia, which translates to hold or keep safe. And it works as follows. Assume that there are two people and their phones generate secret keys. And one secret key stands for 1 day. And during that day, their phone generates codes from that secret key. And these codes are then distributed to the radio using Bluetooth, meaning that phones around you can try to measure the distance of your phone, and if it seems to be close enough using Bluetooth radio attenuation measurements and so the like, then they can keep the code that you generated in your phone, in their phone. And every 10-20 minutes you generate a new code so that it would not be as easy to track you. And the important part here is that all these codes are generated on the phone rather than somewhere else. So should it happen that the lady becomes ill, let's hope it doesn't happen, then the phone will ask her to report to the patient portal, because we need to confirm the diagnosis. Because given the current policy, if you receive a notification from such a contact tracing app, you would need to self-isolate, meaning that a school student, for example, might want to send the whole school home by hanging around all his friends during break times. And we don't want that. So we only want everybody to be able to mark themselves as infected with a confirmed diagnosis for COVID-19. So we allow our app to make use of the same infrastructure that I described earlier, the patient portal. The contact tracing app allows the user to authenticate him or herself to the patient portal using Smart ID or Mobile ID. And then from the patient portal, using the same quick self-diagnosis check that I introduced earlier, we can learn whether the diagnosis was a real one. And then using a pseudonymous process, the secret key from the phones will be sent to the health agency backend, the server. And twice a day, all other phones will be downloading the list of infected keys from the server and then calculating whether any of these codes that they have seen, they have stored in their phone from the Bluetooth signals, matches the secret key of one of the infected people. If that is the case, then the person receives a notification and is encouraged to self-isolate and contact the authorities for further guidance. So the Estonian contact tracing app was built using the distributed privacy-preserving proximity tracing project and Google and Apple's exposure notification API. Instead of using one-time codes as infection confirmation, which is what most of the governments have done, our app allows the user to authenticate against the patient portal and confirm the diagnosis result. So the result of all of this is that through over 10 years of investment into secure infrastructures, digital ID, healthcare data exchange services, the e-health information system, when the crisis struck this year, we were able to quickly build up new services and make them high quality and secure services. For example, the infection confirmation service for the contact tracing app could reuse existing services, and there was no loss in the tests to reports ratio. In countries where one-time codes are used, you have to ensure that all the hospitals and clinics give out these codes to the people who they have tested. If you don't ensure that, then these people will not be able to use the app. They will not be able to mark themselves as infected reducing the functionality of the app considerably. In our implementation in Estonia, everybody who has gotten a test will be qualified to mark themselves as ill in the app, with the one exception of underage people who cannot legally use the digital ID to use their data in the citizen portal. For that, we are developing further authentication methods, proxies, whether they can be helped by their parents, for example. And this also meant that we cannot impersonate another person when we are using the contact tracing app. The data in the app is anonymous for as long as you authenticate yourself to the patient portal. Until that time, everything is private, and through surveys among the population, we learned that privacy is important to our people. Now let's talk about the future. In the future, we see that there will be even more control over the use of data. There will be both personal control and regulatory control. So I will tell you about a pilot project where we used a privacy-enhancing technology called multi-party computation to link and analyze tax and education records. Let's consider IT education. In this diagram, you see there are years and student numbers. And these are IT students enrolled into the 4 largest IT universities in Estonia. We're a small country, so the numbers are not very large. But still you can see that even though the number of IT students kept going up over the years, then we have a very high cancelling rate. Many students are not graduating on time. They don't finalize their studies. So this was considered to be a problem in the long run, because by continuing these studies, by completing them successfully, the students would learn advanced skills which allow them to create more value to their employers, whether private or government. So we wanted to understand why this is happening. The universities were suggesting that this is happening because students work during their studies. The companies were quick to argue that if a student is lazy, then the companies cannot make them learn. So the idea was that let's have a big data study. Let's pull together the records on working and education and then see whether working is related to not graduating on time. So the source data we could use in Estonia are the tax records, whether the student has worked recently, which period, and as an additional aspect, was it an IT company? From the education records, we would want to learn when did the student enroll, when did he or she graduate, and was it an IT curriculum? And this is something where just pulling that data together is not trivial, because you run into 2 barriers. These are data protection, but not only. Also, tax secrecy. The tax secrecy aspects are a little bit stronger than data protection, because data protection has exemptions for like healthcare or statistics or things like that, or for research even. But tax secrets are not very easy to clear for these other uses. So we built a proof of concept project that used secure multi-party computation. The source data was 10 million tax records from the Estonian Tax and Customs Board and over 500,000 education records from the Ministry of Education and Research. The ShareMind technology, which is a multi-party computation technology from cryptographic research, was hosted by 3 government agencies. First of all, the e-government agency of Estonia, the Estonian Information Systems Authority, the Ministry of Finance IT Center, who are maintaining all the tax and customs software and systems in Estonia, and Cybernetica as one of the parties in the program. Data owners used the ShareMind encryption tools to protect the data on premises, meaning that secret sharing technology was applied at the Ministry and at the Tax and Customs Board. And because this technology was used, then data never existed outside the source organization in an unencrypted state. All these three hosts of the system, they could only see encrypted randomness in their databases, and they didn't have the key to decrypt it either. Instead, they were using secure multi-party computation tools to run a privacy-preserving analysis of everything. The system was distributed, meaning that to achieve a query, you had to have consensus among all the hosts that this is a safe query. So ShareMind's distribution technology also ensures that in addition to not being able to see data during the study, you cannot also run queries that are not in the study plan. So we're providing an end-to-end encryption guarantee to data analysis, which is rather novel. The results were delivered to the social scientists who were running the study, and they built a report and put together a report to the industry and the universities and the government. The result was inconclusive. There was no clear relation between working during studies and not graduating. And here are two diagrams to illustrate. We found that the graduation rate among non-IT students was around 40%, and the graduation rate among IT students was 20%. And we saw that the graduation rate among IT students was rising carefully, whereas the non-IT graduation rate was dropping a bit, although the differences are not statistically meaningful. This study was run on data from quite a bit of time ago, so we can also have an interesting example here. On the left, you see data from non-IT students, and these are employment ratios. The green line is for first-year students, the red line for second-year students, and the blue line for third-year students. And we see that during 2008 and 2009, there was a significant drop in the employment rate of both IT and non-IT students. And this was obviously because of the great financial crisis during that period. However, interestingly, what we see was that the employment rates among IT students dropped a little bit more than among others, especially with the older students. We also see that older students tend to work a little bit more, which is obvious because as they move through time, they get more job offers. So this technology, we believe, will allow more policy making, more decision making, also on data which is considered delicate or sensitive in other ways. Since then, it has also been tested on tax fraud, welfare fraud detection, where we would be processing companies' trade secrets. So we believe that a secure data analysis capability will be an important part of the future government. And that concludes my talk for today. I will be now answering questions. Answer to the first question. The question was, were there similar issues in the EU with enacting the GDPR, where some partition group, for example, healthcare or finance, moved forward first and then the other domains followed? We have seen in the European Union that the General Data Protection Regulation has been enforced, but not as strongly everywhere and not as strongly as it would be required. So we see that certain countries have been stricter in its enforcement, and certain countries have not been enforcing as much as possible. Obviously, there is a lot of pressure on Ireland, where a lot of the European headquarters for large international technology companies are, like Facebook LinkedIn, Booking.com, Twitter, Google, and so on. Also Apple. So a lot of pressure was put on Irish courts, where many court cases were filed. However, if we start looking at domains, then I would say that finance has been pretty strong in trying to apply GDPR, because they are used to being a very regulated industry. So they are considering GDPR as a new compliance exercise, which is not fully the ideal approach. Ideally, I believe that GDPR is meant to push us in a certain direction, and maybe then in the future it should be replaced with something less strict when we have learned to build better information systems that respect privacy more. Whether I foresee situations like this, where GDPR is applied inconsistently, snowballing into an unfixable problem, I believe that GDPR's enforcement will strengthen over the coming years, at least in certain countries. There is a strong push towards ensuring privacy, and the Central European countries are following it. Now the question is whether there will be a problem of innovation and the lack of innovation. Whether we will leave certain services unbuilt because we cannot build them in a privacy-preserving way. And this, I believe, is a risk. And that is also why a lot of my own work is in building new and innovative data-driven services, but based on the privacy requirements of this age. I believe that we can build services which support the government, support the companies, and make the life of every citizen better, even with privacy. So I'm hopeful that there will not be large problems in the long run, even though the GDPR regulation does not get enforced consistently in all European countries. And as a last question, so how can we engage various sectors with a human-centric view on data use so that innovations can become active earlier? Here I am not fully certain what is the right answer, I have to say. I strongly believe that we are working our way towards a future where either the person has the ability to control the use of their data, or technology will ensure that this person's data cannot be abused or misused or tied back to them without their consent. Estonia is also building a consent system for the reuse of government data that the government has about an individual. However, not everybody will be signing up to give consent on their data, and certain greater good projects, which are like analyzing location data for mobility or certain healthcare services, would need to be run on data without asking for consent. And this means that there is both a requirement to aim towards training, more awareness in people in how to use consent services properly and how to know one's rights. And also in the field of technology to ensure that services that require more data that can be feasibly acquired by using consent can also be built. Thank you so much for listening, and I wish you a great further conference.